Next, our first panel on income support programs, effectiveness, and goals. It will be moderated by Leyva. Ellen is the, as most of you probably know, the co-anchor of the KABC News at 4 and 6 o'clock. Ellen grew up in a bilingual household in Arizona, graduated from Arizona State with a degree in broadcast journalism. She started at KABC 18 years ago as a health reporter, so knows a lot about the issues that we're talking about today. She's a member of the Walter Cronkite School of Journalism Hall of Fame. She's the recipient of the Impact Award of Excellence in TV from the National Hispanic Media Coalition. And I got to just say one other thing about her. Somebody, you can imagine what her time pressures are like.
Sorry, I'm just...
preparing for the 4 and 6 o'clock news. And I was enormously impressed by, in preparing for the conference, she really took time to go through the subject of the panel to make sure she was well informed about the panel and the panelists that she would be interviewing. And she managed to do that at about, we had a conference call at about 2:30 in the afternoon, and I was just thinking, my God, she's got the news in an hour and a half. Ellen Leyva.
Thank you so much. I really appreciate it. And thank you so much. It is such a pleasure to be here with all of you because I am so honored to be here. I see a room full of kind, generous, altruistic hearts who really care enough to make a difference and improve the lives of children living in poverty in California. So thank you. It's an honor to be here. And I'd love to introduce my incredible panel here today that I'm so honored to be on stage with. First, let me introduce Kim Belshė, Executive Director of First 5 Los Angeles and board member of the California Health Benefit Exchange. Good to see you.
Hello.
And I have Professor Ann Huff Stevens, Professor of Economics and Director of the Center for Poverty Research at UC Davis. Went from Davis or Sacramento last night. And Lydia Ramirez, Director of Health Benefits Resource Centers, Daughters of Charity Health System. And last but not least, Thomas Saenz, President and General Counsel of MALDEF, Mexican American Legal Defense and Education Fund. So thank you all so much. And I know that you want to have some solutions today, perhaps really make a difference today. And it's just a discussion. We'll come up with some good ideas. Can we begin with you, Professor Stevens? And what do we know from the research about what public assistance programs like CalFresh, Medi-Cal and the EITC, what can they do to help children living in poverty?
Sure. We actually, I think one of the big changes in research over the past 10 years is that we have a new line of research that really shows very rigorously what academics like to do is fight with one another and argue, no, you haven't proven it, you haven't proven it. But what I think has emerged is that we now know that CalFresh, the food stamp program, has dramatic positive effects. It improves birth weight when mothers have access to CalFresh when they're pregnant. It improves children's educational attainment. The EITC, expanding generosity of the EITC, has been shown to improve academic achievement. We also know a lot from research that also shows that dramatic reductions in income can have really wide-reaching effects. So job loss is associated with increased mortality, higher rates of disease. Income volatility causes similar problems. And so that just tells us that any programs that can try to smooth out income, provide support, have the potential to prevent a lot of harm.
Now, and that is the good news. However, Kim Belshė, can you tell me, we've seen that government healthcare reform, government benefits are only as useful as the people that can actually get them and actually apply for them. So from the research shown today, we saw that in California, only 50% of eligible families are enrolled in CalFresh. Less than 30% of the state's poor are enrolled in CalWorks. And then depending on the county, some between 42 to 84% take advantage of the EITC. Now, given your experience with 2 California governors' administrations, what can the government do to make it easier for these families to get those benefits that Professor's talking about?
Yeah, it's such an important point, and I know we'll talk about some of the gaps in the social safety net, but you know, as Ann just said, the research is clear that the social safety net absolutely makes a difference in the lives of families and children, but for far too many families who are eligible, they're not enrolled. And there are a lot of reasons why that's so, and the poll that Grace did kind of itemized some of those key issues of lack of awareness, lack of ability to navigate public systems, the stigma associated with public programs. So there are a variety of issues that represent barriers across a whole array of health and human services programs. I'm currently most involved in Covered California, which is California's health benefit exchange, which in my mind represents a major social policy shift that has the potential to really change this dynamic and to really facilitate the ability of people, families and children who are eligible for programs to get connected. Well, why is that so? Well, first off, there is a social policy change. For the first time, we're saying, as a matter of national policy, comprehensive, affordable health care is a social policy goal. So this idea of near universal coverage is a total paradigm shift. Now, I want to underscore, near universal is not universal, but still, the social policy goal, by and large, is that almost everyone should be eligible for something. And so, by definition, federal law has changed the rules and has simplified eligibility and enrollment in terms of the specific requirements. All those different categorical requirements that made it very difficult for families to get connected and individuals in poverty to get connected to health benefits, those have basically been replaced by a single income standard. Moreover, the means by which families can now get connected are multifaceted and vastly simplified. So through in-person enrollment, online enrollment, over the phone enrollment, this idea of no wrong door is a total shift in government policy, helping people actually get connected to the services for which they're eligible. Final point is it's not just about health benefits. We know that so many families, if they meet by and large the Medi-Cal eligibility requirements or Covered California requirements, in all likelihood they're going to be eligible for other benefits. And so this, in jargon bureaucratese, we talk about horizontal integration. And we're not there yet, but it's an aspiration of the Covered California Board. And already in the application we've developed, we ask questions at the end saying, are you interested? You know, it looks like you may be eligible for CalFresh. Are you interested in learning more? Are you interested in getting connected with the systems to get you enrolled in those programs? I think it's a very important step in the direction of automatic or near universal or near automatic enrollment into programs. We're gathering this information from low-income families once. We shouldn't make them go through repeated eligibility and enrollment systems. Covered California is a very important step in that direction of horizontal integration of the social safety net.
And I think, Lydia, your Daughters of Charity offers like a one-stop shop, and that families can go there and find the health benefit resource centers in those 5 hospitals that you run. Talk a little about that, because that does seem to help accessibility and help people learn if they're eligible for any of these programs.
Yes, you know, when listening to the results today of the survey, I can attest to the fact that we hear that day in and day out. The families are challenged not only living in poverty, the other issues that they have where they live, just to make decisions about what do I get? CalFresh, Medi-Cal is complicated. So our one-stop shop is purposefully established in a sense that, like Kim mentioned, if a family is eligible for Medi-Cal, we want to introduce CalFresh. We want to introduce any other community resource that will enable them to move out of poverty. The reality is that, you know, there's just, the system is complicated, but I'm very happy to see, and you know, I can attest also to Kim's statements. Being a grantee from Covered California, you know, we see that. We see that the strives are lined up to simplify the process, and I'm very happy to see that. We see it also in CalFresh as far as families are having to decide to buy food or pay the electricity bill. And in reality, you know, there's a lot of programs out there. What we need to do is we need to line them up. Agencies need to not work in silos. We need to take leverage of the expertise that each agency brings and start creating the bridge from poverty to self-sufficiency for these families. So our one-stop, you know, is successful in doing that. We have been able to actually enroll over 8,000 individuals into different health programs. And we see that what is successful is providing families the time they need to ask the questions they need to get answered in a setting that is respectful, that provides the dignity that they deserve. Just being poor doesn't mean that they have to take these benefits. They need the time the setting, the environment, to be able to ask the questions, is this an issue with public charge? Is this an issue that's going to affect my children? There's a lot of myth historically with government association, and we have a lot of work to do to dismiss that. But our centers, you know, are focused again in providing a Q&A session that takes, you know, quite some time. It is an investment. And we do it very successful. We today can talk about how our approval rates, you know, speak to that testament, having a 96% of our medical applications approved. We recently started Covered California enrollments, and we see the stigma associated when we introduce it as government. But I also am very pleased to see that the future holds solutions, because with this Covered California, we're actually introducing both government and private, you know, aligned, and people can actually move from one to the other. And it's qualified health plans. It's not just Medi-Cal, you know, they're actually able to do that. So I'm very pleased to see that we're on the path, and this conference and bringing all of these individuals together is very powerful, because just like any of us need information, our families are empowered with the information they receive.
And if I may, this is a big change from the past, where, you know, in the past, our policymakers will say, well, you know, we want to expand coverage, or we want to, for healthcare or for public assistance or CalFresh, but then there's little, if any, effort to actually get the word out.
And
to
how
provide
does government do
in-person
that?
assistance. And so as a part of the Affordable Care Act, federal health reform, federal policymakers acknowledged that that was going to be important. And California policymakers, under Governor Schwarzenegger and continuing under Governor Brown, and now with the Covered California Board, we have put a couple $100 million into outreach, education, and marketing statewide, but most importantly in some respects, especially for low-income populations, at a very granular level in communities, working one-on-one in terms of providing assistance to families, breaking down those stigmas, the barriers, and really consciously saying, if people are going to be eligible, we want to connect them to that, rather than we're going to create a program and then erect a bunch of administrative barriers and not do any outreach and education.
And one of the big problems, though, is when you mention government and then you mention the 2.5 undocumented immigrants in California, many of them who have children who could have these eligible programs. Thomas Saenz, you've done so much work with MALDEF. What do you find are the big barriers for those kids that could have assistance, but perhaps their parents are afraid to apply?
Well, I think it is what you described. It's a fear about the potential consequences, both long-term and even short-term, in terms of applying for those programs. It's important to note that the whole construct nationwide, including in the state of California, rests on very restrictive laws with respect to eligibility for programs by immigrants. And I say that emphasizing it's for all immigrants. This is not just an issue that's faced by undocumented immigrants. It's also an issue that's faced by lawful permanent residents. Now, those are folks who have been admitted to this country in legal status, and they are here permanently. After 5 years, they're eligible to naturalize, provided they can meet all the requirements, including an incredibly hefty price tag to apply for naturalization. But even with respect to those immigrants, there are barriers to access to some of the most important anti-poverty programs that we have. And I think it's important that in California we be aware of this, we discuss it, because when we talk about solutions, we bear a certain responsibility in this state. That basic construct around eligibility for anti-poverty programs, both federally and at the state level, came in the Welfare Reform Act of 1996 in Title IV. Now, it is absolutely clear that Title IV was catalyzed by this state's enactment in 1994 of Proposition 187. Absolutely clear. There's no question that Title IV would not be in the Welfare Reform Act, but for this state having enacted Proposition 187 in 1994. Now, this state has changed. We're now one of the most immigrant-friendly, immigrant-integrating states in the country. But we still face these long-term repercussions nationwide for what this state did 19 years ago. And that's why I think in a discussion about solutions, Californians bear a particular responsibility to address this framework. And I'll add one more thing. When we talk about comprehensive immigration reform today, we are talking about a law that, at least in the forms currently being debated and discussed, would make this situation even worse. Because we would, yes, provide legalization to millions of people who have earned it, But at the same time, in order to avoid a Congressional Budget Office estimation of costs that would be too high to bear for some of those in leadership and in the membership of the House of Representatives and the US Senate, to avoid that cost, we have provisions in place that would take this ineligibility for anti-poverty programs and apply it even longer term to those who end up in some provisional status as a result of the legalization program. Right now, comprehensive immigration reform is absolutely needed, but as currently being debated is a program that would allow people to be eligible to work, which is what they want to do. But if, as often happens for too many people, they end up unable to work or losing a job, they will not have the ability to access the safety net programs that are critically important to everyone.
So what is the solution to that?
I think we have to make sure that that debate about immigration reform, and here again, I think California bears a particular responsibility, has to be recognized as an anti-poverty program from top to bottom. Providing status is a special step toward that, but we've got to ensure that all of the other provisions of the law reflect a similar mindset.
And that poll did say that 2/3 of Californians would be willing to pay more in taxes to help children in poverty. So that is a good step toward that. Now we just need to get policies implemented. And also I think we were talking about education and how do we educate some of these younger people to perhaps tell their parents, it's okay, we can apply. How do you get the word out? Is it through schools?
I'm going to chime in. I think it's a different points of touches. I think we need to start and really repeat the same message. It's safe, it's okay. And actually, you know, going to the children is actually a good strategy because I myself, being a child of immigrant parents, I did a lot of the interpretation for my parents. And it's sad to me that, you know, many years later, I see that still occurring. People come to our office and they bring their children just in case they won't be able to communicate in the language. So starting at that level, communicating with the children and educating them about, you know, what does this mean to me and then what does this mean to my family? Because we have seen children come into our office and we had a situation where a family and we were helping mom. An 8-year-old gets up and says to my staff, crying, "Thank you for helping my mommy." And you know, it's very heartbreaking, and it's occurring today in this wonderful state. And we do need to touch them at schools, at churches, where they play, just like Cover California Strategy, where they play, where they work, where they go and worship, because those, and we have to repeat the same message.
Yeah, I would just add that I think another important point of contact, and it sort of ties into the great speakers before this panel, has to do with employers. Over the past 2 or 3 decades, our anti-poverty policies have very systematically brought labor markets into the picture. And the fact is, I think all these points about access are really important, but the fact is, until we address what's happening in low-wage labor markets, expanding access, increasing generosity of social programs isn't going to be enough. And one role employers can play is to make workers know what else is out there and sort of form a connection between what we think of as social assistance and these low-wage labor markets that we as a nation have said welfare recipients should work, but we have a responsibility to make those labor markets a place where workers can actually thrive.
So the Earned Income Tax Credit and Cal works directly through the employer, is that correct?
Well,
or, that it works through employment of the parents?
Sure, you have to be employed.
Yeah.
I mean, this raises many of the issues that the first speaker pointed to, which is that it's one thing to have a job, it's another thing to have a job in which the employer sort of shows respect for your situation and your needs, and there are many things workers can do. I'm working with the Shriver Report on an index of very small steps that employers can take to make sure that even low-wage workers have respect in the workplace, like giving them their schedules more than 24 hours in advance, like allowing unpaid or paid sick leave without punishment. And I think that's how we have to broaden our thinking about what assistance programs are to include employers. And also they can pass on information, of course.
I think that's certainly true in the context of the Affordable Care Act. There's a lot of focus on the individual obligation that most people will have effective January 1 to have a minimum level of coverage. but there are also obligations on employers. And so I think we will be seeing larger employers, 50 and more, we'll be seeing employers play a larger role in working with their employees to connect them to coverage, either through the workplace or indirectly through the health benefit exchange. The approach we've taken at Covered California that Lydia touched on is we want to support Californians in connected to coverage, working with them where they live, where they work, where they play, where they pray. And so hopefully, how many of you have already seen some ads, some social marketing? Are you Facebook friends of Covered California? Our ads, I mean, that's more of the generic statewide and regional outreach. But again, we are investing tens of millions of dollars to support education and enrollment of people where they live and with trusted sources of information. And that's not necessarily government, with all due respect to government. It's churches. It is employers in many respects. It's schools. It's preschool sites. That's where we are putting resources because many people, especially lower income populations, they need help. They need trusted sources of information to work through some very real concerns, particularly mixed families where there's a public charge concern or consideration among the undocumented.
I think that there are two solutions that we really have to consider. The first is we just have to simplify these laws. There is an issue of language access for all immigrant communities. California has probably had the longest Bilingual Services Act in the entire country, but it seems to be more honored in the breach than in compliance sometimes, even for the most common language, which is Spanish. So first you have to make it accessible in the languages that the immigrant communities speak and understand. But beyond that, even if it were all in English, it's written in an English language that even I as a lawyer have trouble understanding sometimes, because we have to have the most complicated anti-poverty program laws in existence. And they've become complicated over time because we have failed as a community to defeat certain mythologies. We have complicated laws because of the mythology of widespread fraud. We have some of these laws about public charge because of an outdated, frankly, notion that is on our books and maintained on our books precisely because of mythology that people somehow migrate to this country in order to access anti-poverty programs, where there's not a shred of evidence that that is the case whatsoever. So we first need to simplify the laws and policies that govern all of these programs, but make it much easier for those who have the trepidation to actually go online and read something to be able to understand what they're reading. But second, we have to recognize the leadership that exists in these communities. By and large, that means using the promotora model, which I think is being discussed up here, and that's taking some of the leaders from the community, training them to then go out and talk to others. And they have the confidence of their community members, and they have the ability to reach them at times that are convenient and provide them with important information. That's the kind of program I think that Kim is talking about, where you get out into the community. You are using folks from the community, promotoras is the term that's generally been used, and it's highly successful. But it requires us to depart from long-standing models of service provision and recognize leadership within communities.
And aside from Daughters of Charity, are there any other programs that assist people in the application program and maybe follow up? I think that's an intimidation factor, like you said, because it is so complicated.
I believe there is. And I think that there's a lot of organizations that are focused in the same goal as we are. At the end of the day, it is trust. It is, you know, the Cover California opportunity campaign that's out there. Everybody hears about it. But at the end of the day, is what does it mean to me? What does it mean to my family? You know, what is the implications, benefits, pros and cons? So we just need to leverage our resources and ensure that we know who's out there. I think that's maybe one gap. There is many organizations doing that. We just need to find out who they are and leverage resources.
And again, from a Huff perspective, you know, our commitment through Covered California is to train and certify tens of thousands of what we call certified enrollment counselors. And it's still a work in progress, but thousands have been trained. And again, it's using the promotora model. It's people who have the cultural and linguistic capacity and expertise, who are trusted sources of information, who can work one-on-one with families through what is a much more simplified eligibility and enrollment process. I've been really gratified to see we've enrolled to date almost 200,000 newly eligible Medi-Cal folks who become newly eligible come January 1. We are receiving completed applications now for Covered California to the tune of 15,000 a day. 15,000 a day. And part of this is because the process is far simplified. And when we've been doing some after the fact reaching out through focus groups, roughly 2/3 of the Medi-Cal population, which is the lowest income, said the application process was clear and easy to use. No one would ever have said that about the Medi-Cal process just a short couple of months ago. Is it the be-all and end-all? Absolutely not. Is it a step in the right direction? Absolutely. Is it the gateway to other social safety net programs? You bet.
Yeah. I'll just add another really important thing that's emerged in the past few years is community organizations that will help workers apply for the earned income tax credit. Mm-hmm. So instead of workers having to go and pay half their refund to a tax prep service, in all sorts of communities there are groups that will help people go through the tax form to make sure they get their full earned income tax credit, right, which is really valuable for a lot of families.
Upfront loan places.
Yes, so they
take
don't
a lot of money
go
out of people's pockets.
Exactly, avoid those.
Someone asked, given the Affordable Care Act, what options will low-income illegal immigrant children have in California that perhaps used to go to an emergency room? What happens to them?
Well, in LA County, if you are an undocumented immigrant child 5 years of age or less, you will be eligible for a First 5 LA funded comprehensive no-cost coverage program. So there's really no child under age 5 in LA County who should be uninsured between Medi-Cal, I guess we don't have healthy families, Medi-Cal, Covered California, private coverage, or the safety net. For children above age 5, regrettably, there is not much of a safety net beyond some baseline preventative services through what's called the CHDP, or the Child's Health Disabilities Program, funded by state dollars, and of course the emergency room. This is an outstanding agenda item for our state policymakers, frankly.
And I would just add, I mean, we have to ensure that our primary care clinics continue to thrive. I mean, I think the danger after the ACA and its implementation is that somehow we conclude that there's less of a need for those, but in fact, short of emergency service, that's where a lot of undocumented immigrants are able to go and get served. And we have to make sure, with the number of such folks in this state, that we continue to support those clinics and allow them to continue to provide those services, or else we're going to end up with a major public health crisis in this state and around the country.
I think that's really important. I was talking with some representatives of community health clinics a few weeks ago, and they're very optimistic that as the ACA is implemented, some of their resources that are now going toward charity care will be compensated through new coverage. But that's, and then they'll have more resources for those who are still left out. But that only works, of course, as pointed out, if we maintain the existing support for those and don't think, oh, that problem solved, let's move on.
I have some questions here if you'd like. I have a lot of questions out in the audience. A lot of, let's see, what's the biggest obstacle keeping families from enrolling in programs for which they qualify?
I think what the research demonstrated in the data, and I hear that at our centers, there's a lot of information about these programs, but it needs to be simplified. Mm-hmm. It needs to be very simple, even with pictures. And I think giving people the time to answer their questions, I think that's important. You know, they need to be able to provide we need to provide the information in a simplified way, respectfully, so that these families can make an informed decision. Mm-hmm. And if they make an informed decision, they will follow through with the process. And I've seen that. Okay.
And knowing low-income Spanish-speaking families as a target audience for Covered California, sorry, I need my glasses. How is a Spanish application made available? Is there a Spanish application for Covered California?
We are doing our outreach and education in 13 different languages. Our website is in English and Spanish. The Spanish language application, for a number of reasons, has been delayed, but I believe will be made public this week. So that is long overdue and much needed. But absolutely critical to increasing enrollments for Spanish-speaking population, because we have a lot of research that paper is a comfortable venue. Lydia can probably speak to that more directly than I, but it's long overdue, but imminent.
How do we simplify the process? What can we do to help government simplify the application process? I mean, is there something that we can do? Write our congressman, what do you recommend that we could do today?
Well, you know, every program is different. And so federal policymakers have already taken a leap forward in simplifying enrollment for health programs, moving away from what in California had been over 120 different specific aid categories to really have a single income-based threshold for eligibility. That, again, is also a gateway into some of the other programs. But for a number of years, like with CalFresh, there was a finger printing a requirement that represented a real barrier, and there was advocacy and a change in law to eliminate that. So every program has different administrative barriers, and Tom, you might have some specifics that you would encourage people to be focusing on.
Well, I actually, rather than specifics, I think we need to change the narrative. I mean, I think these are good steps forward, but in order to ensure we keep moving in that direction even further, we have to change the narrative. We need to demand simplification of these programs and eligibility for them as a matter of government efficiency. I mean, we seem to have this premium on efficiency of government in other areas, but when it comes to actually simplifying some of these processes and getting people the assistance that they need, that's where that notion goes out the window. We've got to change how we think and talk about these issues, and if someone wants to talk about government efficiency, this ought to be #1 on the list as far as I'm concerned. That has to go along with some of the advocacy. The change to eliminate the fingerprinting was a critically important change, and it was a result of activism that went to the state legislature and the governor and said, there's really no need for this and we need to take it out. I think that when we face barriers like that, there is no question that there is not a substitute for the organizing that Maria Elena was talking about.
I would add that I think these issues of simplification and information are incredibly important, but I think they can't be separated from another issue we've talked about on and off this morning, which is stigma. And there's some powerful research that's just come out of Stanford University on a different topic, but showing that low-income, high-achieving kids don't have good information about going to college. And it just makes me think, you know, there's no stigma associated with access to college. That's the American dream. And that problem's hard to solve. And so I think when you combine these information problems with the stigma we continue to put on seeking public assistance, I think we just want to think about both of those as an interrelated set of problems.
Yeah, I believe you gave an example earlier this morning how they didn't want to apply because it was
yeah, I was just
shameful.
saying earlier, yeah. People would come into our centers and say, I want healthy families when we had healthy families. And we would do our due diligence, and then we say, well, you qualify for Medi-Cal. And they, no, I don't want Medi-Cal. I'm working. I'm here as an immigrant. We're talking about legal immigrants, not undocumented only. But I'm here to provide. It is my responsibility. I do not want to be associated with government. So there is a lot of work ahead of us in relationship to stigma. I think education is an important thing. As I'm sitting here listening to the conference, and like I said, our one-stop center, I could just see putting behind each of my workers' cubicle, you know, something that speaks about how college is important and is attainable. But we need to start introducing that early on to our families. Our parents are so, you know, occupied with just dealing with the day-to-day. They're not thinking about college. They're not thinking about, you know, where the kids are going. And we start introducing programs, and if I could see that if my staff introduce a program to them, they are likely to take it on. But we need to become the bridge. We need to be able to say, from here to here, this is how you get there. And we need to be part of the process until we get to a level where these children are going to be leading, you know, in the future. And I think there's a big gap, again, on connecting the resources.
I would say I want to second how important education is, but I want to add to that I think one of the most important long-standing anti-poverty programs in California that is not being talked about as an anti-poverty program and not being addressed, and is possibly the most broken such program, are our community colleges. And that is because they are a dead end for way, way too many kids. Maria Elena talked about those who follow all the rules and get the college degree and still can't find the job that they're looking for. Absolutely true. But there are so many kids who are following the rules, go into community colleges, and it ends up a dead end for them because we are not ensuring that there is equal access and equal success in our community colleges, completion, and moving on to four-year universities.
I'm sorry.
We absolutely need to prioritize that issue.
And I want to compliment with an I and an E. Tom's comment about, and I hope we're going to have a little bit of time to talk about where some of the key gaps are, because the research is also clear about what programs really can change the life trajectory of children. And certainly higher education is critical, but not surprisingly, wearing my First 5 LA hat, I want to put a plug in for quality early education and learning programs. In my mind, there is no anti-poverty investment more powerful than ensuring that our children, when they show up in kindergarten, show up ready to learn. For far too many, that academic achievement gap has already taken root in kindergarten, particularly for children in poverty and English language learners. So when we talk, and I was so gratified to see in the survey that low-income parents is saying their greatest aspiration, their greatest hope for children is K through 12 education. It's got to be pre-K, and every child in LA County and throughout the state and nation needs to have access to affordable, quality, early education programs. That is, in my mind, the single most important investment to get them on a life trajectory.
If I could add just one more angle on the importance of education. Tom mentioned California's community colleges, which are an incredible system. The other thing that those community colleges provide is an incredibly extensive set of vocational education programs.
Yes.
I think we have to admit that every person in America is not going to get a traditional four-year college degree, but there are very powerful, potentially very effective vocational programs in California through the community colleges, very low cost. The problem is that they have also faced budget cuts. We don't know very well which ones work really well and which ones maybe don't work so well. And the potential students don't have access to information about those as well.
Yeah, and you know, it's good that I'm hearing about the K to 12th grade. That's what their parents are aspiring. It's kind of sad that they're not aspiring for college. You know, they're just going to be aspiring, let my kid graduate from high school, because we know there's an issue there. You know, about a 50% dropout rate, and especially in these communities. So I think education is definitely a way out. You know, education is power, empowering our families, and education from the children, but to the parents. You know, there's a lot of education that each of us need to do when we have the attention, a captive audience, educating them about how important all of these resources and education is critical to be, you know, be able to provide them, and they can be, you know, on the way out of poverty.
And maybe those first 5 years will, you know, inspire them to go on to college and help them get that grain planted, or the seed planted, rather. What are the percentages of kids who do have preschool, access to preschool in California?
I know the super smarty pants from First 5 LA who are in the audience know this off the top of their head, but I believe it's roughly 50%.
Oh, okay, so not as many as...
No, but roughly 50% have access to preschool, but not necessarily quality preschool.
Oh.
And it is all about quality, and we know that children who graduate from a quality preschool program are more likely to be math and reading proficient by 3rd grade, to graduate from high school, to have higher income, to have lesser dependency, crime, etc. So that's why we say, you know, if we care, one of the strongest anti-poverty programs around is investing in quality preschool. We agree with the president, and I would note call to action here at home in terms of things we can be doing, notwithstanding the president's leadership and creating a teachable moment about the importance of quality preschool. With all due respect to Congress, it's probably not going to happen in the near term. But it is happening here in California through Governor Brown's leadership and what's called the local control funding formula, which has directed more resources and more flexibility to schools that have a disproportionate number of English language learners, children in poverty, and foster youth. The very children who stand to benefit the most from quality preschool. So the advocacy play right now is with local school districts to advocate for the direction of some of those resources to proven programs to get kids ready for kindergarten and ready for success academically.
That is something we can do.
That's
is something we can do today, which is a good thing. We only have 3 minutes left. That is not possible. Do you think it's unfair to sign people up for benefits as soon as they file for immigration? Why not steer them towards employment? I guess that goes to education again.
Well, I think, you know, people need to have a mindset where they can then focus on employment. I mean, if they're sick, they can't go to work, you know. So I think everything goes hand in hand. We need to provide them the tools to be able to be gainfully employed. If someone is sick and no access to health care, they won't be productive workers. I mean, how can they go out and look for a job if they're not feeling good?
And we talk about employment, and a lot of these employers are hiring part-time work so they don't have to pay the benefits, and that seems to be a growing trend. So, covered California.
Yeah.
There's some specific rules that relate to how many hours employees have to work and the total number of full-time equivalents. It's something we'll be watching very closely to see if the requirements of federal law create some different approaches to hiring by California employers.
What message would you like to leave today for everybody here? What do you think is the most important thing we could do, or I guess the most important policy that can be changed to solve the problem?
I think there's so many policies, it's hard to pick out one, but I would go back to the polling data that was given. We need to take advantage of the fact that people are willing to pay more in taxes in order to pay to support anti-poverty programs. We have to ensure that our revenue structure in this state and indeed nationwide is reformed, because frankly the one that we have doesn't work, and it's not really about further cuts in these important services at all, and it's not really about greater efficiency in governmental programs, as important as that may be, emphasizing number one, simplifying some of these processes. It really is about fixing the revenue structure in California and nationwide. We took a strong first step in this state with Proposition 30, but that's only a first step and a temporary one. We have to engage in a longer term reform of revenue in this state and nationally.
Lydia?
Well, in addition to that, I totally concur with Tom's comments, but I think we need to continue to keep this awareness that we do have an issue with child poverty here in California, here in LA County, here in our neighborhoods where we actually live and work, and that we need to be advocates on behalf of those children, and we can't just walk away from the conference and go back to our silos. And I think that's something, again, I just want to reinforce, is learning about the resources that are out there, leveraging and strengthen the collaboratives that already exist, and be part of the resolution.
Yeah. Professor Stevens?
I would come back to the point that we have made this very strong connection between almost all social assistance programs and employment, and we need to take a very hard look at low-wage labor markets and employers in this country and start to take seriously the fact that our economy has meant that workers at the bottom are getting less and less, and we have to start addressing public policies around that. And yes, we can require workers to work, but then we need to think about what we can do to make sure that work actually pays a living wage.
Okay.
I would concur with what the survey found regarding the parents of low-income parents in terms of their aspirations for their children, when they said the single most important thing for heightening and enhancing the future prospects of their children is education. And in that regard, I think an investment in quality early education is the single most significant anti-poverty as well as pro-workforce and economic development investment that policymakers can make.
Very good. You've all been wonderful today, and I thank you so much. And